About early childhood decay and the state problems in Ukraine, prevention and management. Let's start. Department of our Pediatric Therapeutic Dentistry, created on 28th of August 2009. And personal composition: 1 doctor of medicine, professor, 5 associate professors, and 8 assistants of our department. As a department, 1 doctoral and 1 thesis of antenatal prevention and early childhood decay, caries. Introduction. Of course, enters among the most common medical problem in children in the first year of life. It is health throughout the world. In low-income households and in developing countries, the extent of the disease is comparable to that of an epidemic. Is an extremely active form of caries and one of the most common reasons for hospitalization of young children who have their teeth extracted. You can see clinical cases. It is decay. And then what we have if a patient don't treat their teeth. Next one. Therefore, today it is very important to search for both highly effective way to prevent childhood decay and effective method of treatment that contribute to the formation of the positive attitude of the child towards visiting the dentist. Expert American National Institutes of Health, it was proposed definition early children caries, characterizing availability one or more caries defect, cavity or non-cavity, removed due to complication of caries or sealed temporary tooth, a child under 72 months. You can see the pictures. Caries in young children has been recognized by dentists as a significant problem for more than 150 years old ago. And next one, caries in children early childhood. It is American pediatrician. And you need to know that he in 1862 the first described clinical manifestation of caries in early childhood, and and described as less dentist nose that tooth petites, black teeth in young children. Okay. So, dental caries is the most common chronic infectious disease of childhood, and causes it, as we know, as we remember, by interaction of bacteria. Mainly, it is Streptococcus mutans and sugary foods of tooth enamel, and Streptococcus mutants can spread from mother to baby during infancy and can inoculate even predentate infants. And caries in children, you can see the bottle mouth, so nursing bottle mouth. And in our literature we can see such pictures because children eat at night, and that is why we have such picture. In 1978, American Academy of Pedodontics, they know such thing that juices bottle and caries from nursing bottle. So the initial strategic advice was limited to feeding habit from, which is followed that bottle caries can be avoided if stop bottle feeding soon after the first year from the day birth. Okay. And as factors, winter with quarters gave the name blooming and was defined as an acute caries process that affects many or all of erupted teeth, quickly destroying kernel part of the teeth, often localized on surfaces that are not susceptible to caries, of which early involvement of the tooth pulp in the process. So also literature used terms such as bottle syndrome, night bottle mouth, dental caries from a baby bottle, and dental caries from the breast milk. However, each of the above definitions took into account one or of the many factors contributing to the development of dental caries. At little children. More addition, parents could not figure out in the benefits and risks of bottle feeding. Okay, and on conference that organized the National Institute of Health, two definitions were added. So flowering caries in babies and early children dental caries. So since 1999, I received a late during this conference as the presence of one or more caries cavity and cavityless removed due to caries or sealed surfaces, crowns, tooth in many temporary tooth at a child aged 7 to 1 month and earlier. Then, by Wayne, I identified three types of early childhood caries. First type, it is mild to moderate, so isolated carious lesions on molars and or on incisors. So more common between the ages of 2 and 5 years. Two type, moderate or severe, it is vestibular and palatal carious lesions on the incisors of upper jaw and temporary molars. The third type, it is severe form. Almost all teeth are affected, including the incisors of the lower jaw. Typically occurs between the ages of 3 and 5 and found in 2.5%. And look please at our clinical cases. Next one. Streptococcus mutans can spread from mother to baby, yeah? And these bacteria break down sugars for energy, causing an acidic environment in the mouth and result in demineralization of the enamel of the teeth and dental caries. Early childhood caries is a serious public health problem in both developing and industrialized countries. So, this type of caries can begin early in life, progresses rapidly in those who are has, for example, high risk, and often goes untreated. Its consequences can affect the immediate and long-time quality of life of the child and family, and can have significant social and economic consequences beyond the immediate family as well. To the date, the term early childhood caries for determination of any caries lesions of on any surface of the tooth emerged in the first 3 years of the child's life. The late childhood caries include the presence one or more caries cavityless removed due to caries or sealed tooth crown surfaces. Okay, it's any temporary tooth in child aged from 3 to 6 years. Epidemiology. Dental caries in toddlers and infants has a distinctive pattern and different names and terminology um, have been used to refer to the presence of dental caries among very young children. The definition first used to describe this condition were related to etiology, with a focus on inappropriate use of nursing practice. The following terms are used interchangeably. And early childhood decay, tooth decay, baby bottle feet, tooth decay, early childhood dental decay, comforter caries, nursing caries, maxillary anterior caries, rampant caries, and more. Some of these terms indicate the causes of dental caries in preschool children. Baby bottle fat, tooth decay, refer to decay in an infant teeth associated with what the baby drinks. However, some authors use the term nursing caries because it designated inappropriate bottle use and nursing practice as causal factors. Just also articles, look please in this slide. However, the term early childhood caries is becoming increasingly popular with dentists and dental researchers alike. The term early childhood caries was suggested in 1994 workshop sponsored by the Centers of Disease Control and Prevention in an attempt to focus attention on the multiply factors. Early childhood caries is defined as the presence of one or more decayed or non-cavitated or cavitated lesions, missing teeth due to caries, or filled tooth surfaces in any primary tooth in a child 72 of months age or young. In children younger than 3 years of age, any sign of smooth surfaces caries is indicative of severe early childhood caries. From ages 3 through 5, one or more cavitated missing teeth or filled smooth surfaces in primary maxillary anterior teeth or decayed missing or filled score. It is early childhood caries or bottle caries. And in the initial phase, this type of caries is recognized as a dull, right demineralized enamel that quickly advanced or to obvious decay along the gingival margin. And primary maxillary incisors are generally affected earlier than the four maxillar anterior teeth, which are often involved concurrently. I'm sorry. Caries lesions may be found on either the labial and lingual surfaces of the teeth and in some cases on both. The decayed hard tissues is clinically evident as a yellow or brown cavitated area. In older children, whose entire primary dentition is fully erupted, it is not unusual to see a considerable advancement of their dental damage. Look, please, the spots, yeah, from yellow to brown or black. And epidemiology, despite the decline in their prevalence of dental caries in the children in the Western countries, for example, caries in preschool children remains a problem in both developed and developing countries. Early childhood caries has been considered to be at epidemic proportions in the developing countries. Then, a comprehensive review of the occurrence of the caries on maxillary anterior teeth in children, including numerous studies from Europe, from Africa, Asia, Middle East, North America, found the highest caries prevalence in Africa and Southeast Asia. The prevalence of early childhood caries is estimated to range from 1 to 12% in infants from developing countries. Prevalence of early childhood caries is not a common finding relative to some European countries, for example, Sweden, England, with the available prevalence data ranging from below from 1% to 32%. However, this figure is risen by as much as 56% in some Eastern European countries. In US, preschool children data from a more recent study indicated that the prevalence of dental caries of children from 2 to 5 years of age and had increased from 24%. Published studies show higher prevalence figures for 3 years olds, which ranges from 36 and to 85%. And early childhood caries has been considered at epidemic proportion in the developing countries. Studies conducted in the Middle East have shows that the prevalence of dental caries between 22% to 61%. In Africa, between 38% and 45%. In Ukraine, for example, Western Ukraine, 8 areas, yes, and we have some statistic. So we have prevalence dental decay in children under 3 years, 82%, and intensity 2.35 teeth. So Kharkiv, Donetsk, Lugansk, and Zaporozhye regions. And development risk factors at young children. Of course, this among children with childhood decay increases with age. Then no pattern in the prevalence of early childhood caries in the presence diseases in the antenatal period in different regions. Then children with systemic diseases has a significantly higher risk of developing early childhood caries. And there is a correlation and relationship between the degree of dysbiosis of the oral cavity baby and the intensity to decay these caries. Then etiology. The etiology of this form of caries is multifactorial and has been well established. It is frequently associated with a poor diet and bad oral health habits. And about influence mother diet, so number of consumed fat and food additives, so pregnant in the first trimester, has a strong direct correlation connection, yeah. And share proteins and carbohydrates in nutrition. A pregnant woman in the first trimester has a strong inverse correlation connection, okay. Then moderate and indicators Apgar scales of when the child has born, and explained influence at 23 and 3%. I'm sorry. While Apgar score through 5 minutes after birth explained by 26%, and intensity of dental caries in 2-year-old babies. Then Streptococcus mutans and Streptococcus cerevisius are the main carcinogenic microorganisms, and these acid production pathogens inhabiting the mouth cause damage by dissolving tooth structures in the presence of fermentable carbohydrates such as sucrose, fructose, and glucose. Most of the investigations has shown that in children with early childhood caries, Streptococcus mutans has regularly exceeded 30% of the cultivable plaque flora. These bacterial masses are often associated with caries lesions, and white spot lesions and sound tooth surfaces near the lesions. Conversely, Streptococcus mutans typically constituted less than 0.1% of the plaque flora in children when patients, for example, don't have caries activity. Don't have caries activity, yeah. It is well known that initial lesions to mutant streptococcus by infants and occurs during a well delineated age range that is being designated as the window of infectivity. Most of the long-term studies also demonstrated that individuals with low infection level, for example, in the period are less likely to be infected with Streptococcus mutans and subsequently have the lowest level of risk of developing caries. This may be explained by the competition between the oral bacteria resulting in the invasions of the niches where Streptococcus mutans can early colonize by less pathogenic species. Yes. Then vertical transmission, also known as mother-to-child transmission, is the transmission of the infection or other disease, for example, from caregiver to child. And the major receiver from which infants acquire Streptococcus mutans is their mother. The early evidence for this concept comes from bacteriocin typing studies, where Streptococcus mutans isolated from mother and their infants demonstrated identical bacteriocin typing patterns. And more advanced technology that utilized chromosomal pattern or identical plasmids provides more compelling evidence to substantiate the concept of vertical transmission, for example. And and baby with intrauterine infection as a result of an imbalance of intestinal microflora. And feeding practices. Inappropriate use of baby bottle has a central role in the etiology and severity of early childhood caries. The rationale is prolonged bedtime use of bottles with sweet content, especially lactose. Most of the studies have shown significant correlation between early childhood caries and bottle feeding and sleep with a bottle. Breastfeeding provides the perfect nutrition for infants. And there are a number of health benefits to the breastfed child, including a reduced risk of gastrointestinal and respiratory infection. And however, frequent and prolonged contact of enamel with human milk has been shown to result in acidogenic conditions and softening of enamel. Increasing R available is the most significant factor in shifting and remineralization equilibrium towards demineralization. There appears to be a clinical consensus in mostly dental practice that prolonged and postnormal breastfeeding is associated with an increased risk of early childhood caries, especially after the age after 12 months. These conditions explained by less saliva production at night and result in high levels of lactose in the resting saliva and a dental plaque for longer than would be expected during the day. Thereby, balance is shifted towards demineralization rather than remineralization during the night because of the insufficient protection caused by reduced postnasal salivary flow. And admission, so other factors, for example, this admission excess amount of divalent salts, then age mother over 30 and under 20, quantity children 3 and more, low birth weight, and low mineral bone density baby tissue. Microelements. It is, for example, cuprum, ferrum, zinc, and cobalt. Risk associated with early childhood caries, of course, it is an increased frequency respiratory diseases and their relapses. And caries in children leads to the decreased pH of oral cavity, to the sore site, which promotes growth lactobacillus. Of course, we need to remember about the genetic factors. Experimentally by determining the expression of the BMP2 genes and osteocalcin in the lower jaw of mouse embryos was found influence pyrophosphates diet. So, Nessa Igorevna. Genetic factors, yeah? Also, clinically, the development of systemic enamel hyperplasia, focal demineralization of hard dental tissues, and in the future caries defeat. Of course, morphological structural changes in preparation, both buds and influence high content diet, cholesterol. When analyzes scanning electron microscopy photographs of incisors and lower molars of 28-day-old mice born from mice were on the diet with a high content before and during pregnancy, so with cholesterol. There were violations of the structure of the enamel and of the surfaces of the teeth, namely abnormal defects of incisors and of the tubercles of the lower lateral teeth. Mhm. Treatment of caries, it's a complication of young children is an extremely difficult process because we work with baby, we need to work with parents, and it's very hard for a dentist. Often it is necessary to resort to treatment under general anesthesia, yeah, sedation method. But such assistance, on the one hand, is expensive, and on the other hand, it is unsafe for a child since the duration of anesthesia for most children average 2.8 hours. In addition, negative experience with dentist as at early age can leave unpleasant memories for a lifetime and lead to development stomatophobia, and as a consequence, the premature loss of already permanent teeth. Have children from 1 to 5 years old with multiple carious lesions of the teeth due to age-related uh, psychophysiological characteristics. Early childhood caries is initially recognized as a dull, white hand of demineralization of enamel that quickly advances to obvious decay along the gingival margin. The decay is generally first seen on the primary maxillary incisors, and the four maxillary anterior teeth are often involved concurrently. Carious lesions may be found on the labial and lingual surfaces of the teeth, and in some cases on both. Their risk assessment of early childhood caries and the main pathogenic factors. Yeah, early infection, violation character and regime nutrition, low-level hygienic conditions of the oral cavity, then psychological hypermineralization, hard tissues of deciduous teeth, decline reactivity organism, unfavorable flow pregnancy, early eruption temporary teeth, then high meaning KPU, yeah, DFE index, and adverse social status. Then features of the structure of deciduous teeth and causing regularities current caries. Uh, Availability on the surface of the enamel, microcracks and micropores, and then thickness layers of enamel and dentin less mineralized, yeah. Then absent immune zones and morphology and the functional image pulp, yeah. Remember about it. Then, furthermore, the expression of early childhood caries was adopted following criteria. So, any sign of caries on a smooth surface in children younger than 3 years. Then, any smooth surfaces of an anterior-posterior deciduous tooth that is delayed and missing or filled in children between 3 to 5 years old. And remember about the indexes, yeah, DFE from 3 to 6 years. Then features of the clinical course of early childhood caries on stage of formation route. So it is, of course, spicy and sharpest current. defeat upper insides in the first place, and spreading along the plane process often spread circularly and affecting all surfaces of the incisor and leading to breaking of crowns. Then symmetrical location of defects can be, and quick their transmission from an uncomplicated form to a complicated one leads to the rapid destruction of the temperatures. And what diagnostic method we can use for make the diagnosis? Of course, we need to know about the speed of demineralization, about stage process, and extent defect. On today, there is no single and globally recognized classification of caries defects. We know it's too much classification, but one, it is defect classification. D0, subclinical defects not diagnosed in intact surface. Then, when examined under the microscope, D1.1 is white opaque spot on the enamel surface and visible after drying. D1.2, the defect is visible against the background of the surrounding healthy tissues. It can be stained brown, the tooth surface remains intact, however loses. Then D2, it is destruction at the enamel dentin border microcavity. D3, it is destruction of the entire enamel laying to dentin. D4, the defect extends to the entire dentin up to the pulp. Then caries defects are more often diagnosed at stage 3 and 4. Although largely preventable by early examination, identification of individual risk, initiation, risk factors, for example, and parental counseling and education. For example, maybe we can care some procedures such as topical fluoride application, for example. The progressive nature of a dental decay can quickly diminish, and failure to identify and prevent dental disease has consequential and costly long-term adverse effects. Then, let's speak about prevention. Oral health means more than just healthy teeth. Oral health affects people physically and psychologically, and influences how they grow, look, chew, how they taste tasty food, socialize, and well as their feeling is of all social well-being. Children's quality of life can be seriously affected by severe caries because of pain and discomfort, which could lead to disfigurement, acute and chronic infection, for example, and altered eating and sleeping habits, as well as risk of hospitalization, of course, of high treatment costs, of loss of school days with the consequent diminished ability to learn. In most small children, early childhood caries is associated with reduced growth and reduced weight gain due to insufficient food consumption to meet the metabolic and the growth needs of children less than 2 years old. Children of 3 years old with nursing caries weighted about 1 kilogram less than control children. because they have toothache, the end infection after eating, and sleeping habits, dietary intake, and metabolic processes. Then, disturbed sleep affects glucosteroid production. In addition, there is suppression of hemoglobin from depressed enterocyte production. Then, there are three general approaches and have been used to prevent early childhood caries. All three approaches include training of mother or caregivers to follow healthy dietary and feeding habits in order to prevent the development of early childhood caries. The strategy to combat the early transmission of carcinogenic bacteria from parents to their offsprings is overnamed primary prevention. The preventive intervention is most often directed to pregnant women and to mother of newborn babies. These include the following: and reduce the bacteria in the mouth of the mother or primary caregiver. Early studies suggest that infants acquire from their mother Streptococcus mutans from their mother and only after the eruption of primary teeth. Preventive intervention for the purpose for reducing the transmission of bacteria from mother to children improve the likelihood of better oral health for the child. Effective approach in the prevention of dental caries is the suppression of Streptococcus mutans in the mouth of the child primary caregiver. So here is regular using xylitol product. So what is it, xylitol? Then chemical suppressions by use of chlorhexidine gluconate in the form of mouth rinses, gels, and dentifrices has shown to reduce oral microorganisms. But we can't use these antiseptics very long time, only 2 weeks, because then we have the resistance of microorganisms. Then we need to minimize the transmission of bacteria that cause tooth decay. Minimizing saliva sharing activities between children and parents, caregivers, limits bacterial transmission. Examples include avoiding the sharing of food, of drinks, discouraging a child from putting his or her hand in the caregiver's mouth, not licking a pacifier before giving it to the child, and not sharing toothbrushes. The goal is to prevent or delay children as long as possible from acquiring the bacteria that cause tooth decay. Then, chewing gum with xylitol is recommended for pregnant women 3 times a day for 3 months or after the birth of the child from 8 months of age to 2 years old. I'm sorry guys, 20 seconds. Then It is necessary to inform parents, yes, about the vertical transmission of microflora. I say about it. And motivation and education the parents, yeah, of in a rational oral hygiene. So, at a first stage, all health education, so dental caries cannot occur without the substrate component of sugar. Therefore, more of the professional advices and practical research has focused on modification of the infants' diet and feeding habits through education of the parents. Child health professionals, including but not limited to a physician and some assistants, nurse practitioners, and nurses, can play a significant role in reducing the burden of this disease. While most children do not visit a dentist until the age of 3 years, children have visited a child health professional up to 11 times for well-child visit by this age. And oral health education is a designed package of information, learning activities, or experience that are intended to produce improvement oral health. With the primary goal of disease prevention is to facilitate decision making for oral health practices and to encourage appropriate choices for these behaviors. So we need to brush teeth twice a day, and after first molar have erupted, a small amount of toothpaste is used. And examples of toothpastes. Effective health education may thus produce the changes in knowledges, induce or clarify values, bring about some shift in belief or attitudes, facilitate the achievements of skills, and bring about change in behaviors or lifestyles. And avoiding caries promotion feeding behaviors. First, infants should not be put to sleep with a bottle containing fermentable carbohydrates. The second, at libitum, breastfeeding should be avoided after the first primary tooth begin to erupt and other dietary carbohydrates are introduced. Then, parents should be encouraged to have infants drink from a cup as they approach their first birthday. Infants should be weaned from the bottle at 12-14 months of age. Then, between meal snacks and prolonged exposures to food and juice or other beverages containing fermentable carbohydrates should be avoided. And about fluoride, of course, you can see the table, age group, then concentration of fluoride, frequency of use once a day, and amount. Look, please. The use of fluorides for dental purposes began in 19th century, if you know. Fluorides are found naturally throughout the world, and they are present to some extent in all foods and water, so that all humans ingest some fluoride on a daily basis. Fluoride Fluorides are used by communities as a public health measures, yeah, and here we have a global consensus that regular use of fluoride toothpaste constitutes, yeah. In fact, a global survey revealed that most experts addressed fluoride toothpaste as the main reason. Yes, and this toothpaste we used for teeth. We can prescribe it. Then active substance, yeah, also, and concentration. And you can see the name and examples of toothpastes. And sodium fluoride, such form. The most common method for systemically applied fluoride is fluoridated drinking water, yeah. And of course, we use we have some articles about the reduction in childhood dental decay attributable to fluoridation were approximately from 40 to 60%. This is likely caused by the increase in use to fluoride from other sources, with the widespread use of fluoride toothpaste probably being the most important factor. It is electric toothbrush for children, Philips Sonicare. So we can reduce, yes, the risk of caries transfer from primary teeth to permanent, reduce the risk of crowding teeth and need for braces. Extremely difficult to treat teeth. We remember about this, and more efficiently parents. So 75 more effective than using a conventional toothbrush. Philips toothbrush Sonicare for kinds, and it is learning map, special learning app, and we can correct the right habits and correct brushing technique. So, for example, first of all, it teaches, stimulates, and entertains. So two modes from 3 to 7 years old, from 7 to 14 years old. So special attachment for children with a delicate effect to the enamel. Then rubberized grip for child. And here we have different models of toothpaste and different application. Application training, awards, fun. Then it is article, and some percent we can see. So 98 hygienists recommended toothbrush. Yes, 93 hygienists noticed improvements. Power control. Of course, we need to do the power control, and the dentist begin by talking with the parents about the need to avoid some yes, promiscuous night and evening feeding. Then have a child aged from 8 to 10 months should have no more than 5-6 meals. It is optimal is parental education about the basic, yeah, of feeding a child. Then recommendation. With breastfeeding, refusal to feed on demand. With artificial feeding, the transition to drinking from the cup, and the content of the bottle, of course, only food and water, and stop using the drinking bottle as soon as your child can drink from a cup. In over 1 year old, also number of feeding, no more than 5 times a day, juices and compotes no more than 2 times a day, and juice no more than 100 milliliters, or better through a straw. Sweets and fruits before brushing your teeth. Prohibits snacks, sweet cookies, waffles, chips, corn sticks, yeah. And recommendation for dental care after taking sugar-containing medicinal vitamins preparation, but only with pediatrician. One of the promising areas preventing early childhood caries is using probiotics, with the purpose of competitive settlements of the child's oral cavity, lactobacilli, and bifidobacteria. Research showed that in consumption probiotics, and these effects was most pronounced at children from 3 to 4 years old. It is our article about the early childhood caries. It is early childhood caries state of problems in Ukraine, and it is a journal about modern dentistry, and our article also. Article writing Inessa Igorevna, our professor, and prevention programs. Some research programs was developed of the warning of early childhood caries in Ukraine, but its not study has not been evaluated for their effectiveness in strictly planned clinical trials. We can use fluorine gels and symbiotics for children, yeah. Then complex scream prevention for children with early childhood caries included, first of all, this recommendation about the nutrition, consumption of proteins, food, then application drug, iodomarine, application of multivitamins preparation, calcinova, for example, seal and fissure, use fluorine varnish every 3 months, and training hygiene oral cavity. Then how preventive measures? Yeah. Исаева Надежда Симоновна. Preventive programs hygiene oral cavity for children from 8 to 12 months. Professional plaque removal, treatment, and holding local remineralization therapy. For children who were breastfeeding feedings, yeah, from birth to 6 months, providing parents information about the date of the first visit, recommendation regarding nutrition, and using toothpaste. Selection infant's formula that contains probiotics microorganism. You can see the examples. For children who were bottle feed, prevention program included application drug lactobacillin, clinical monitoring every 6 months, holding training women in daily hygiene skills, selection items and means for the care of pee air, and using seal and fissure. Tsipan Sergei Borislavovich, and dental preventive program. First stage of the program lasted for 6 months and included in yourself. It's treatment on ulcerative enterocolitis and dysbiosis by the gastroenterologist using visual cards and using toothpaste rocks containing aminofluorine and xylitol. With 24 months child reception monoprobiotics containing species strains lactobacillus. Then application fermented milk drink containing probiotics. Professional teeth cleaning. Remineralizing therapy. We work with rocks gel. The use of fluoride drugs. Sealing Fisher and teaching children method of brushing teeth. Then pills and chewing probiotics extract via Gaia for dentist to time. Good results. Then big proportion of children 3-6 years with poor hygiene. And here we need to know that small number of studies of risk factors and prevention. The early childhood caries limits their understanding of how to effectively manage this defeat in Ukraine. Okay, thank you for your attention. And I want to tell you about treatment and we will finish our lecture. So treatment, the tactics of the dentist in the care should include a set of prevention and therapeutic measures. Yeah. So modern approach of the treatment of caries lesion, of course, it is prevention. If we have D 1.12, term prevention treatment is used to refer to clinical interventions to identify the treat early caries lesions. This type of treatment aimed at reducing the action of acid-forming microflora. And what we can do, we can do nutritional recommendation, then prescribe fluoride and calcium preparation, but only when we work with pediatrician. For parents, recommend daily inclusion is fluorinated, yes. And reception preparation of callus, trace elements, vitamins, also with a pediatrician. Antimicrobial therapy, as with clinical signs of early childhood caries, because we need to reduce carcinogenic microflora. In the presence of factor risk, hypoplasia of enamels, night feeding after incisor eruption, frequent drinking juices from a bottle, and high DFE indices of family. Antimicrobial funds, so solution by chlorhexidine, but not too long time, 2 weeks. Varnish Servitec, we use 7-10 days, and we can do an application with a iode. Hyaluronic therapy, so sealing, yes, doing deep fluoridation, doing professional cleaning of the teeth, fluoride preparation, application by varnish 2 times a year. Then important to remember the applied, about the varnish. And we use glass ionomer cements, of course, for doing sealing teeth, and when we apply to early caries lesions, for example, calcium as phosphorus preparations. It's good for local remineralizing home therapy, and we can use rocks, medical minerals. We can use GC company to smooth. They work very good. Then, the basic mechanism of activity is ability to bind calcium and phosphate ions and keep them in an amorphous form. And contraindication to use it, allergy to cow's milk proteins, okay? And we need to ask our patient. Rocks medical gels to special additives is retains well on the surface of the teeth, forms and stable film, which allows to extend the exposure time. And the xylitol added to the gel increased interremineralization potential and also inhibits activity carcinogenic types of bacteria. Then techniques rocks application, of course, directly throughout the brush your teeth with toothpaste before applying the gel. Apply gel on all areas. Recommended the duration the application is 15 minutes. And by after the end of the application, do not rinse your mouth. Then calcium and phosphorus preparations composition by a foam splat, and it includes Japanese liquorice extract and bioactive organic calcium worked out form. And for many years to prevent progression caries process of temporary teeth, dentists use silver nitrate or silver fluoride. Currently, this drug are not used in any of the developed countries as they're in teeth, and which can lead to social management. Yeah. Indication for non-invasive sealing fish of children early ages, availability risk factors, yeah, immature fissures, and pigmented fissures. It's our practical lesson. We speak about the fissure sealing more detailedly. Okay, and recommendations. Rehabilitation treatment. Okay, for example, when we need the restorator, when we need many teeth for treating, we can use sedation method, or we can use some premedication, and step by step we treated all teeth. Then choose a method. Of course, from degree of caries destruction, we use then readiness child to occupation and economic accessibility method. 3 principles: individual prevention, early identification and assessment to risk, and minimum invasive filling. And materials that we can use, modern filling materials. We also speak about the atraumatic rehabilitation treatment, when we can dry it with cotton balls and seal it with glass enamel cement. If the filling was performed in the early stages of the development of caries, this allows you to stop the progression of the process of destruction. But we use this method not very often. And when preparation of class second cavities, it is desirable to form an additional retention team and check the occlusion after placing and filling. And separation is indicated Minimal preparation method, automatic treatment method, but not only hand instruments are used to prepare the cavity, but also a drill. When opening the cavity with burrs or enamel knives, only demineralized enamel is excised, leaving a small inlet. And we can use only glass ionomers in these cases. Chemical and mechanical preparation of dentin, principle of chemical, so removal of caries dentin with chemical softening and subsequent selective excavation. The action of dentin softeners is based on electrostatic rupture, non-covalent bonds between proteins and peptides. It inform as gel and delayed filling method. Not very difficult. It's treatment when we work with deep caries cavities, and they can be successfully carried out using this technique. So we need all caries dentin except for the one line directly above the pulp. And after removal of all infected dentin, the area of pulp is covered with a preparation based of calcium hydroxide, zinc oxide, genol cements, or paste. Sometimes we don't need any base. We work with composites. Then microorganisms transmitted to a child from parents, from brother and sister. Therefore, it's necessary we speak with the parents about it. Then, care behind the baby teeth. The first months after the appearance of the teeth, rubbing with a damp gauze napkin or silicone finger brush 2 times a day. Use toothpaste and sweet. Try to give food in the first half of the day. At the evening, vegetable sandal candy. So once a week, and visit a dentist every 3 months. One clinical case is so anamnesis, pregnancies, and postnatal period were normal, but breastfeeding up to 1 year, teething from 6 and 5 months. The child is healthy. The pediatrician is consulted for colds no more than 2-3 times a year. Allergic anamnesis not weighted down. The teeth were looked after irregular brushes with a toothbrush without paste. And oral examination. You can take photo and prevention plan. Okay, what we need to do, it's all steps. Where necessary, please take a photo and write in your synopsis. And first stages of the treatment, professional hygiene. Then we use automatic method, but it's very not very often. Okay, we need to do a necrectomy from all infected tissues of teeth. And material glass ionomers. And after it's the second, you can take photo and write about first you can write in your synopsis first visit, second visit. Okay, and in these cases we use the Campamere, glass ionomer with composites, and name of this material Twinkie Star. Thank you for your attention. I think you have our Facebook, our Instagram and YouTube channel. And if you have some question, guys, please write in Google Class, and on our practical lessons we will speak about all of your questions. Thank you. Have a nice day.